Since the pandemic, Americans' mental health has been on the decline.
Today, a bill moved forward in the Nebraska legislature that would help expand access for mental health treatment. Channel 8's Matthew Mittleiter has more.
Nebraska health officials say mental health conditions are rising nationwide, but services are not always easy to find. However, there's one bill in the legislature that would expand access to mental health and substance treatment to Nebraskans. The bill was introduced by Senator Anna Wishart of Lincoln, who says during her 6 years in the legislature, she's heard a lot about how Nebraska lacks mental health services and how that shortage impacts prisons as well as the calls for service to law enforcement. Her bill would aid in the development of at least 6 clinics in Omaha, Lincoln, Fremont, Kearney, and Hastings through the state's Medicaid program.
I think they're going to do a real number on reducing some of the criminal justice issues we're seeing. Pretty much every single person that I represented and that others have represented who are in the criminal justice system are dealing with substantial mental health or substance use issues.
The bill would provide services on an outpatient basis, expand capacity for those services, and establish more coordination for delivering service with community partners. The clinics called for in the bill are similar to federally qualified health centers that provide a variety of health care services to low-income families. Supporters say there are numerous different groups from both sides of the political aisle who are backing the bill.
From the ACLU of Nebraska to the Douglas County Sheriff's Office to the Veterans Coalition to the Nebraska Medical Association, it is really an impressive set of advocates and individuals that have come together to support this common sense measure.
Senator Steve-Erdman, who opposes the bill, says not everyone who misbehaves and ends up in the criminal justice system has a mental health issue, and what really needs to be done is to have more discipline in schools.
I'm not here to tell you today that I don't believe there are people who have mental health issues. That's not the case. But what I'm telling you, every person who has a behavioral issue does not have mental illness. It doesn't appear to me that this bill seems to be the answer.
Erdman says the bill would also require teachers and people who are not mental health experts to address mental illness. Reporting in Lincoln, Matthew Mittleiter, Channel 8 News.